Okay, thank you very much. Thank you very much. First of all, I'd like to thank the management of Elken. They have a wonderful team. I think they deserve a round of applause. Thank you very much, Mr. Samuel, for making this possible and inviting me through Miss Kate. I'd like to thank the group of Miss Jin Hee, whom I have mistaken for a gentleman through my email, so my apologies there. It's very fortunate that I have met some old friends like Baba Cheng there, and of course the other people who made it very, very good and smoothly. I thank you very much, and especially for the nice red tie that you gave me as a gift. So thank you very much to the Elken team. I'm wearing it. Thank you. I was asked to give my personal clinical experiences regarding MIME. And I will make it worth your while. The 1 hour that you'll be staying here will pass by unnoticed. It will be both be fun but educational as well. And I hope that after my talk, you will take it with you and you will have more conviction in the use of MIME as I have for the past 5 years that I have been prescribing it in the more than 20 years plus of my medical practice. Okay. Please take a look at the slides that was prepared. I'd like to thank Mr. Ivan and of course Mr. Wong, who slept late last night, for polishing this. And thank you very much, and even for the conversion into Chinese. Thank you. If you will give me a minute to talk about how I came to the practice of nutrition after studying for more than 10 years in the oldest and top university in the Philippines called University of Santo Tomas. Like most doctors, after graduating in 1987, I practiced for 2 years using the regular hospital synthetic medicine. Thank you for the water, sir. I understand this water is special. You cannot buy it outside. Thank you very much for this. Because I love arts, I like drawing, I paint, I was planning to go into cosmetic surgery after 1987. In fact, I spent already the next 2 years doing breast cosmetic surgery. Enlargement or augmentation or making it smaller or moving other body parts to wherever the client wants it. But I met this gentleman, the man in the middle. At that time, he was the secretary or the minister of health for our country. And at that time, he was looking for young, fresh graduate doctors who would like to make a difference in our practice. As you can understand, 20 years ago, the country is still a third world country, although we follow the American type of medicine. Therefore, many of our countrymen cannot afford the expensive procedures, the expensive medications. And this gentleman in the middle opened my eyes and said, "Hey, Dr. Bien, what are you doing right now?" I said, "I'm doing some breast surgery." And he said, "At the age of 70 is still what you want to see?" And then he asked me some questions which changed my paradigm. He told me, "What are the medications you normally give for diabetic patients?" Of course, I outlined the tablets to lower down the blood sugar, the insulin injections, and then he asked me, "Does the diabetes go away?" Thinking about it, no, it only lowers down the sugar, but the diabetes is still there. And in fact, even the complications will eventually come. He said, "What do you give for high blood pressure patients?" Well, of course, I give the one that is oral, or I put the one under the tongue, or sometimes I do injection to bring down the blood pressure. Does the blood pressure or hypertension go away permanently? Oh no. And then it came back to me that many of the medications that doctors spend a lot of years memorizing from the pharmacodynamics of it is actually to cut down on the symptoms and not to cure the root cause of the problem. That is difficult to swallow. And the last thing that he asked me, what happens to your patient after you put all those silicone under the breast? They get cancerous. So after 2 years, I dropped everything and followed him. And I was very thankful because with him, together with the other lady that you see in the picture, the lady you see on the picture, who later became a beauty queen, I think one of our first Miss International. And this gentleman ran for the Senate. He asked me, go outside of the Philippines, look for countries that are offering nutrition, and when you come back, use it as part of your treatment. I have never regretted that day. Until the present time, until last night when we are having dinner, they asked me, how come you have so much conviction when you prescribe MIME compared to the other doctors who does not believe in it? Because I know a person who has some more weapon to prevent or treat the root cause of the problem is better off than a patient who only has symptomatic treatment. And MIME plays a very big role in that. So thank you for allowing me to explain my side. Now this is the nice thing about the Philippines. 20 years ago, this senator, who was a former Secretary of Health, has only one law that was passed. And that law is in effect until now. We call it the Traditional and Alternative Medicine Law. It requires graduate doctors of the Philippines to consider in our prescription the addition of nutrition with the other medication. Sadly, not everybody follows, especially the older generations. And I believe it is true as well in Malaysia and in many other countries also. Correct? Correct. But Dr. Flavier, the name of my mentor, has some other ways to help the patients. We went into media. We went into radio broadcasting, which later on became a television show, and later on he passed away a few years ago, but I continued his legacy, going into the rounds of the media, going to different countries to talk about the law of our country on natural medicine. Now, 80% of my practice, because we have a very high incidence in the Philippines, maybe because we follow Western diet, is made up of cancer. Of the 80%, a majority of it is called malignant. That means the patient has a terminal case. When we say terminal case, normally the other doctors like to give a life sentence of about 5 years. When a person is said, oh, you only have 5 years to live, of course no one is willing to accept that, because that's painful. A person will always look for something to help them. So if you take a look at the slide, the recognized clinical management in the Philippines, as well as in the other parts of the world, is still the three things: to do the surgery, to cut it. After they cut it, they inject you or give you medication to poison the cells that they were not able to cut. And to further aggravate things, they burn it using radiation. I have nothing against it. In fact, I co-manage patients undergoing the three treatment: surgery, chemotherapy, and radiotherapy. But this is where the problem lies. Those three is aimed at killing only the cancer cells, but at the same time, it destroys the normal cells. That's why patients go bald. That's why patients lose their appetite. They get pale, they get very thin, they get very weak, and many succumb not to the cancer, but to the treatment itself. If you've heard, our very popular lady president who started the EDSA revolution, the one where we went into the street after about 20 years of dictatorship from another president, she had colon cancer. After only several sessions of chemotherapy, she said, no more. The side effects is worse than my own cancer. And she died. She died. She's got all the money. She's got all the resources. If only the doctors would have given something to improve the immune system of the person. And that is why we are lucky. Today, you're going to learn about it. You're going to see my actual cases. Patients who believed in it. And patients who are better off now than before and better off than many of their colleagues in the hospital who have passed on and they are still living. There is a debate among doctors regarding lifespan length. Some doctors will say, okay, if I give chemo, I give radiotherapy, and I do surgery, I give patients more than 5 years. But that is 5 years of misery. That is 5 years of pain. And many of the doctors do not believe that anymore. Because what is 5 years if those years are spent in the hospital with tubes coming out of your body, attached to a machine, and then later on dying with strangers surrounding you and not even with your family members? That is not the kind of quality of life that we aim for. So right now, there are the new doctors like me that was trained by Dr. Flavier who are willing to try products that will give quality of life. That is a key word that I wish you to remember and repeat. We are not always going to promise a cure, but we can offer a QOL, a quality of life, and a scientific way to improve their health. Even with the most sophisticated instruments, surgery poses a risk. Just by cutting it, it is being spread to the bloodstream, and then before you know it, cutting one side of the breast, it exposes the other breast to metastasis or spread. There are many radiotherapy machines now. They burn it, but at the same time, the burning passes through the breast, goes through the lungs, goes through the bones. So lastly, many of the cancer medications that are labeled chemotherapy are allowed only to be recalled 2 or 3 years later and said, oh, they cause heart attacks. If you read some of the journals, a lot have been recalled because they cause heart attacks. How? They kill the heart muscles. So your heart stops beating. Crazy, isn't it? Now, in all of this, we cannot say cancer is a death warrant. No. This is where integrative medicine, some people call it natural medicine, some people call it nutritional medicine, will come into play. This is your role. Maybe some of you are doctors, maybe some of you are into nutrition, but the reason I am willing to give talks like this is because so that I can reach out to people who are exposed to 10, 20, 50, or 100 people. Some of those are suffering from terminal illnesses. Imagine if their doctor would not allow it, then it is your role. Because you know you are giving something that is useful for that person. You all deserve a round of applause for this. Amazingly, many of my colleagues believe that this is one of my trip in the US, or I think in Europe, that our product is only to reduce pain. No. Or to give them sleep. No. Or to be at peace. They believe that what we are prescribing, although it is legal in many parts of the US and Europe, like cannabis or grass or marijuana. But science is dynamic. If you take a look at this, CAM, as you can see in the slide, means complementary and alternative medicine. That means anything that is in addition to their usual traditional prescription, if added to a patient, if you take a look at the arrow, there is an expected improve in the quality of life. And on the third arrow, or the second arrow, you see an expected boosted immune system. When we say quality of life, what do we mean? We mean the person feels more energetic. That goes away when someone has cancer. Later on, the person develops depression, cannot sleep, they have anxiety, cannot eat, and their life is miserable. Those surrounding the cancer patient, their life as well becomes miserable because he or she is irritable. When we add something to boost the immune system, the person feels energetic. The person is able to eat. The person will be able to sleep. And there is less pain. So while the other medication works its way, by boosting the immune system, there is improvement in the quality of life. So this is quality of life. And what is true now may be untrue in the future. But what is always basic when patients or people ask me, Doctor, what do you suggest for people who suffer from chronic, degenerative, or cancer cases? Go back to basic. Simple life means simple meal. To slow down. Our pace is too fast. To have peace of mind. Not to worry about things that we cannot change. To always be grateful. And to take something that you believe in, which you know is natural, organic, and has been researched, is evidence-based, approved by scientists all over the world. Thank you. And that is the mycelia immune modulated extract. These are the quality of life that patients suffer from according to American Cancer Society. On the right are all the symptoms. When we are able to help at least one half of it, that is quality of life. So, according to my mentor, whom I did not believe 20 years ago, the medicine of the future is really called pharmaconutrition. That means the use of nutritional medicine, whether we believe it or not now, or whether our doctors believe it or not now, together with the usual surgery, radiation, and chemotherapy, would be immunotherapy. And that is the future. And you are involved in something that is futuristic. Thank you, Elken, for that, isn't it? 20 plus years of success. Congratulations to all of you. I understand you look wonderful in red and black. I know you are leaders. So as leaders, you are the movers of this industry. In the middle of the slide is a dark green colored called allopathic medicine. That means the westernized form of medicine. Surrounding it would be the complementary medicine. If a doctor focuses only on allopathic medicine, the patient is going to be less compared to a person who receives. As you can see, there are natural products to the right. There are mind and body therapies listed underneath it. And at the bottom level, I think these are what you do with Elken here in Malaysia, correct? Yes. So a round of applause for Guasa, please. Oh, these are some of the slides, just one slide where I learned some, or rather I conversed with some of the researchers and some scientists in other countries related to the use of MIME. And this is MIME. You know what it is. MIME is an immune support dietary supplement from the mycelia, that means the root of lentinula. It is designed to produce, to enhance our own immune system. And that is through the natural killer cells. Nothing can actually claim not surgery, chemotherapy, or radiotherapy, say it's a guaranteed cure for cancer. Right now, the only thing that can cure cancer, like the lady who gave a testimonial, is our own body. Our body produces what is needed to fight off cancer cells, as long as we provide the precursor, the ingredient, so that it can produce the two kinds of cell, the T and the B cell. And the T and the B cells will produce our own natural killer cells. That is simply putting it for explanation of this slide. But there is an addition to what MIME can do. It can help produce dendritic cell. A dendritic cell makes it possible for the body to recognize a cancer while it is still beginning. You do not have the cancer cells, but it may be growing inside of you because you're exposed to someone who is smoking. Or maybe you are taking always the wrong kind of fast food. So what the cancer cell is there, while you are healthy, even MIME may be good for you. Do you follow? It's not only for cancer cells. It is always good for everyone. These are some of the studies done on MIME, as you can see. You can see the orange color of the bar graph. With the introduction of MIME, we realized that there is an increased production of natural killer cells against colon cancer. Another study will show, you can see this is the intestine, or we call the gut. Inside the intestines, what we call the Peyer's patches. Those small organelles, the Peyer's patches, produce the two kinds of cell, the T and the B cells. And that is why we take the MIME orally. Because once it enters our digestive system, it now goes into our intestine, and in the intestine, production of the natural killer cells is hastened. As you can see, and this is where many surgeons disagree with some practitioners, when a person is taking something to improve the immune system, like MIME, the survival after the operation is much better. There is less bleeding, there is less complication, the patient gets out of the ICU faster, and over the actual stage of it. With MIME, as the orange line graph will show you, there is a better survival rate after surgery. So, as you can see, the Philippines, because of its law, the Republic Act 8423, we tend to convince many of our surgeons. As we understand, there are surgeons who would say, do not take MIME or other immune stimulating products before the surgery or after surgery or while undergoing chemotherapy because they may interact with our medication. But new science has shown, and we are glad that we have the law, that we can combine it with their treatment and they have nothing to worry. And what do we say to the patient if they are afraid to do so? I simply mention, MIME comes from mushroom, and mushroom is food. It just so happened it is a very nutritious food with a particular purpose to boost your immune system. Don't you want that while you're getting well? So people now will agree. However, the patient is still taking the chemotherapy. There is a synergistic effect. What do you see? There is less nausea. There is less vomiting. There is less pallor or becoming pale. The patient measurement for anemia is improved. Now, who wouldn't want that? The that the response to chemotherapy is much better. Because many patients are not able to finish the 6 cycles of chemo. After the second dose of chemotherapy, are ready to call it quits. Their skin is bad. It's so dry. Their hair is only a it is in their pillows already. And then they cannot eat. And they're miserable. Imagine if you find something to give to them like MIME, and they do not have those symptoms, then they will readily accept the fate of chemotherapy. This is a proof, the synergistic effect of MIME before and after. As you can see, there is less loss of hair on the mice. As you can see, there is increase, or rather there is decrease in the size of the tumor. Are you still okay? Do you find it too technical? Okay, thank you. Not too fast, isn't it? All right, good, thank you. Okay, so I think we are half of our slide, so I hope you will still be with me some more. This slide is only to show you that the side effects of multi-drug chemotherapy is reduced markedly with MIME. And now, these are interesting cases. If you'll permit me, for each case, maybe I'll give about a 30-second or 1-minute introduction of what happened to this case, why it came to me. And I only have 5, and of course there are more, but I think for time restriction purposes, am I okay with time? All right, then we can discuss 5. For purposes of privacy, Mr. Wong was very nice to have covered part of the face, which is the eye, and the full name of the person, and I hope the contact number, because maybe some of you will be texting this person. How are you already? But these people have agreed that I take their picture, not really for presentation here, but during the treatment, because I believe we will be making a big difference in their cases, and so they have agreed that we document their cases. Some pictures may cause some discomfort. Well, we are all adults here. Just cover your eyes if you think it's too weird. And this is a case of a male, 39-year-old, with throat cancer, stage 3. You can see the drawing that I made during our first consultation. When he came to me, there was a tube sticking out of his nose. 12 weeks with that tube sticking in his port. So a lot of people are afraid, why is there a big tube sticking out of his nose? He has throat cancer. Throat pharyngeal cancer. When we go into it, we use a needle, take a sample, we call it fine needle biopsy. Some call it biopsy. We get a very small sample, we place it on a slide, we take a look at it under the microscope after putting some dye, and then we are able to know what kind of cancer cells are inside. For this particular case, it is called adenoid carcinoma. It is a cancer that grows rapidly. So when there is already growing through the nostrils. That's why when he speaks like this, doctor, check up ako. Because there's something growing inside. And he keeps swallowing because there is something that is blocking his throat. So can you see the discomfort in the gentleman? This is his picture. So there's a circle there. If it is enlarged properly, you can actually see the mass. We call it the fungating mass that is growing from here and then extending upwards and then extending downwards. That's why there is a tube coming out of his nose, is because he has undergone surgery. But he refused chemo and radiotherapy. The doctor initially removed that mass, but it grew back. So he doesn't want to do any more surgery. That's why he came to me. And these are his presenting problems. He has chronic sore throat. He has bouts of fever because of the infection. There's difficulty of swallowing. We call it dysphagia. Because you cannot swallow, you cannot eat. You cannot eat, you lose weight. Upon introduction of MIME, we documented his case for I think about more than 6 months. Okay? But in less than 6 months that we were doing it, the sore throat is resolved. The fever was gone. He was able to eat and to swallow, and there is weight gain. I think you should clap once you see the next picture. This is him afterwards. Do you see the smile? Although it's a small picture, do you see the smile when he was receiving the MIME? If you take a look at the throat, there is less inflammation inside. And if you take a look at the skin, he is less pale. And notice, he has hair. Successful case. Thanks to MIME. That is not only quality of life, that is actually improving his condition. Second case. There is a lady who traveled 8 hours by bus from the northern part of the Philippines to reach my clinic in the city, and she traveled in the evening taking a bus by about 9 or 10 p.m. so that she can reach my clinic at about 8 a.m. Unfortunately, although my clinic opens at 10, I do not come to work until 1. I have fatherly duties in the morning. So at 1 o'clock, I saw this lady. She is some sorts of a school principal. She was diagnosed to have one of the most deadly kind of cancer. It is cancer of the pancreas. Many of you know where the pancreas is. It is in the middle of the abdomen. Surrounding it is the small intestine called the duodenum. On top of it is the stomach. And on the right side of it is the liver. And underneath that is the gallbladder. When the pancreas is big, is huge, is inflamed, it blocks all of those things. It blocks the stomach, the duodenum or the intestine, the liver, and the gallbladder. So what will happen to the patient? She will be yellow. Jaundiced, we call it. She cannot eat. She will have pains. Of course, she will lose weight. And she will become not only yellow but pale. And if you notice, I made a drawing of the heart on my initial consultation because it has affected the beating of her heart as well. So she was devastated as a principal to be given this diagnosis. The funny story is, her assistant principal, when she filed for a leave of absence, removed all her belongings on the table, including the pictures of the family, and placed her own pictures there. Less than 6 months later, this principal came back to the office and declared that she's okay and ready to work. Can you imagine? Can you imagine the shock of the two people? First, the principal, all her personal belongings are gone on her table. And of course, the assistant principal, who was feeling to be promoted, has to go back to a lower, smaller table. This is her picture, or rather, this is her case. She has abdominal pain. I did a laboratory test called CRP to check if there is an inflammation ongoing. Of course, I knew that, but just for documentation, I saw that it was elevated. There is a mass that I can feel. She has a very big abdomen. She's yellow, and she cannot breathe properly. When we introduced MIME to her, reduced pain, the jaundice or the yellowing was gone. She was able to go back by traveling by herself, this time with no companion, after only several months of taking the 8-hour bus from her place to my clinic, see me for about an hour, and then go back to the 8-hour bus ride. And she has normal activities of daily living. That means she can do household chores and go back to work. This is her picture. Notice how big, this is her uniform that she is wearing. That's why she wears the same clothes. But you can see from the very big abdomen to the abdomen that is normal. Pancreatic cancer is one of the deadliest cancer, and normally patients with this are given 1 to 2 years to live. I saw her just last month, and we've been going steady for 5 years. I saw her last month so that I could sign a waiver that I am allowing her to travel by plane to Canada to visit her family. She brought me back chocolates. So the payment for doing this job is not only monetary. It's not only about chocolates. It's the smile. It's the satisfaction that you really did good. We share that to all of you. This is another case of a man. Cancer of the testis. One of the rare form of cancer. We do not know why people get this. Maybe it's the same way as cancer of the ovary. It's hormonal. That means it could be genetic. Now, a person with cancer of the testis will ultimately receive the suggestion to cut it off. Now, who among this room, a man, would readily agree, all right, you can cut my balls off. No, we value it very much. But he doesn't have a choice. It has spread to his bones. He couldn't walk. He's always in pain. And to top the problem, he's got diabetes. So he's got skin condition. It is dry, it is flaky, there is wound, and the wound does not heal well. Can you imagine the suffering? You have diabetes, you've got a wound that is getting gangrene, and you have no testicles anymore. You cannot perform your manly duties to your wife, and you are confined to a wheelchair. Terrible. So these are the things that he suffers from. Chronic back and joint pain because it has moved to his bones. A chronic skin infection, and that skin infection is due to a bacteria that is resistant already to the many different kinds of antibiotics. It's called the Staphylococcus infection. We call it the MRSA, or methicillin-resistant Staphylococcus aureus. The kind of bacteria that eats the flesh. Of course, he was feverish, he's got depression, he was irritable. We did the MIME. It is difficult to say to this patient and to the relative that, okay, we can offer a cure. But I mentioned to the family that at least we will be able to help him with his quality of life. Yes, take a look at his picture. Sorry. The skin lesion is gone. It is clear. And this is the very nice thing that I would like you to take a look at. Notice the big picture with his foot. Do you see? Do you see anything beside his hand? That is car keys. He is back to driving. A guy who was confined on a wheelchair, couldn't walk, was driving. That was enough to bring a smile to his lips. I think this is one of the last of the two slides. This is an elderly lady, considered at 73. When they approached me, they told me the story immediately, that she is an ordinary street sweeper. She sweeps the street. So she couldn't afford any treatment at all. But she has stage 3B, stage breast cancer. When you say 3B, that means it has spread to the lymph nodes. But she is a member of a church, a Christian church. And she was approached by their pastor, several pastors, 2 lady pastors, who said, well, we're not a rich congregation. We will help you, but we can afford to give you only one choice. You choose. You either have surgery, chemotherapy, radiotherapy, or immune system therapy. Of course, she chose the cheapest one, the immune system therapy. She came to my clinic. Thank you. Before Christmas. Before Christmas, not this Christmas, but the Christmas years before that, and you can see, this is her breast mass. My apologies to those who are not used to seeing actual mass. You can see it's about the size of a fist, isn't it? Do you see that there are some Christmas balls in the background? That means it's nearing Christmas, isn't it? Yes. That is stage 3B. Of course, I gave MIME. My usual dosage for MIME is about, of your product, 3 in the morning and 3 at bedtime. I like giving it between meals so that there's no food to contradict its digestion and absorption. Okay. So that is the minimum dosage that I gave to her. After Christmas, it was almost past Valentine. We took another picture, and this was her, these are her presenting problems. She's got financial inability to undergo any treatment. She has increasing size of the mass. Of course, it is painful. It is tender. And there is an increase again in the CRP. That is a blood test for inflammation. When we gave MIME for almost 4 months, there is marked reduction of the breast mass size. It's not painful anymore when I touch it. She has improved appetite. She loves vegetables. She's got weight gain. And when we took our picture, this is her picture. Do you see the big difference in the size? Do you? It used to be near the nipple. The tumor walked upwards. Being a street sweeper, she cannot afford to pay me. And until the present time, it has been, I think, 2 years, I get paid every week by a bag of vegetables, which she picks up on the street. I don't know what river it came from. I still enjoy it. Vegetables. Last case that I would like to show you. This is a male with a terminal case of cancer, given less than 2 months to live. It was a relative, a distant relative, who called me up. A guy, he said, "Cousin, my father-in-law has undergone everything, but has now less than 2 or 3 months to live. Can we do something else for him so that it doesn't show to my wife that I'm not doing anything?" So they came to me. Also, because this guy smokes a lot, he developed a cancer of the throat extending to his neck. So the same case, he's got a tube coming out of his nose. The problem is, compared to the first case, this person could not talk. He could not communicate. It has already affected his vocal cord, the larynx. So the way we communicate, when I ask him, is we have this simple, I still don't know how they call it, the whiteboard that is used by children, where you raise the plastic to erase it. And you bring it down and you write on it again. So he lists his problems there. Because he's hard of hearing, because it has affected his ears, I also list my documentation to him through that board. So we're communicating just by writing on his slate board. This is him. See the neck? Those are lymph nodes. They're huge. They're painful. They may open as a wound that does not heal. See his tongue? It's yellow. And the phlegm cultivates the bacteria. And that bacteria goes to the neck, goes to the ear, and goes to the throat. He's got hoarse voice, a recurring fever. He's got a thick white coat on the tongue. Because of the fungus, he is anemic, generally very weak. With MIME, we were able to give it for about 8 months. There's improved strength in the voice later on. Although hoarse, he was able to communicate with me. The fever was gone. The coating on the tongue was gone. There is improvement in his anemia, therefore his strength. And I hope you take a look at the wife of my cousin who was very happy. Do you see the smile on the gentleman? That is less pale, less tumor. Did you enjoy the cases? So as a practice, although I see a lot of cancer patients, I still see diabetic patients, I still hypertensive patients, stroke patients, and I see even children, because my practice is wellness and integrative medicine. These are people who are brought to me because they are not happy with what they're receiving from their hospital medicine. They would like some more. So the relatives are willing to take it. And of course, we choose only the best. As I mentioned to the management yesterday, of the 80% of cases who come to me, which are cancer cases, 7 out of the 10 will always come out with a prescription for MIME. Why? If the person has surgery, there is a longer survival rate. It is a support to whatever chemotherapy that patient is receiving or radiotherapy. And whatever side effects he is feeling, I am sure in a matter of months, maybe 3, 4, 5 months, it will be markedly reduced. There is also a reduction in the side effects, and I'm quite sure I'm offering a quality of life to that person which he will not receive from his previous medication. So I also now prescribe MIME even to those who are not sick. We have to realize our body is fragile. We cannot afford to take something that is good only when we are sick. Especially the gentleman, this is as well true for me, we spend more for our cars than our body. We are willing to buy thousands worth of mags or tires that is new for our pet car. So I encourage now people who are healthy to consider taking it as well to prevent illnesses in the future. These are the benefits, as you can see. A study done on healthy adults, the orange marker will show you that even if you are not sick, if a person will take MIME, there is increase in the production of dendritic cells. That dendritic cells will recognize any future cancer that can grow amongst us. Again, you can see that even after, you can see the orange bar, but you can see the yellow bar. Even 30 days after taking MIME, a person is still protected. I think that qualifies for a round of applause for our MIME. Imagine, 30 days have passed since the last day that you have taken MIME. You are protected. So there is now a trend, I hope, among young doctors, among professionals like you, to appreciate the use of MIME, not only for cancer patients, but for the general public as well. Although there is not a definite, a specific definition for quality of life yet, because it is subjective, we have seen a physical, a psychological, and a social improvement when patients take MIME. And the patients are better served when we combine our regular hospital medicine with immunotherapy. Doctors and nurses must recognize that. For the people who was able to be part of MIME, because of Elken, because of your experience with them, this is a blessing, not only for you, but I hope you become a blessing for others as well in the many years to come. Thank you very much.